You're watching CTOM TV. Knowledge is power.
And now we're going to talk about precision oncology. As I said earlier, that is simply defined, that is personalized cancer care. It is using the most current diagnostics and treatments directly applied to each individual cancer patient as they need it and when they need it. Our system is miles away from using precision oncology to its fullest extent right now, but we're here to tell you a little bit about what it is and what it looks like and how, again, to help the public healthcare system provide you with better care. Our whole job here at Cancer Treatment Options and Management is helping cancer patients not have to travel, not have to change doctors, and still get a far more accurate diagnosis and a far more effective treatment. And we've been at it for over 11 years in Canada with some great success across the country in all provinces. So we'll help you figure that out. Okay, so if you think about precision oncology as having four main elements, just to try to simplify it for you to remember, again, you'll get copies of this presentation, but in your brain, I want you to be thinking, okay, there's the diagnostic piece. I want to make sure that I get proper genetic and molecular testing, and we'll tell you what that means in a moment. Then I want to make sure that somebody who knows what they're doing and has the time is actually taking a look at what that data that I've just gathered from these tests means for me based on my history, the mutations that showed up in my case. And then we want to make sure that somebody's actually designing a treatment plan based on that data, not just saying, oh, you have ovarian cancer. We usually give everybody with ovarian cancer this. That is not precision oncology by any means. And you want to make sure somebody's really taking a look at what's happening for you and designing a treatment plan specific to that. And then the last pillar of precision oncology is special types of treatment monitoring. So we've just kind of gone on about PET-CT. That would be one of those elements ideally, but we'll talk about another one that's really critical to make sure that you find out as quickly and as accurately as possible if your treatment is working, when you're cancer-free, and when there's a recurrence. So we will just talk a little bit about genetic testing. So Alex, would you like to take over now and talk a little bit about this stuff?
Sure. Yeah. And thank you, Michelle. You've done an amazing job. I really love the way you are able to simplify these complicated scientific concepts.
Thank you.
So genetic testing. Well, as we know, cancer is a disease of the genes and the DNA. I'm hoping everybody knows what that is. It's the coding that makes up all biological life. And so it's separated into chromosomes, and those chromosomes are subdivided into genes. Each gene has a specific function. It creates a protein or some sort of enzyme, creates a biomolecule, and these biomolecules fit together and work together and create biological life. So what happens in cancer is you will have damage to four specific signaling pathways in cancer. So in other words, a normal cell will accumulate a mutation in one pathway, and then it will accumulate another mutation in another pathway, and then another mutation in another pathway. And once you have these mutations in these four individual pathways, then that cell will become cancerous. So there's specific pathways, they're well defined, we know what they are. But there's many, many different genes in each pathway. So every person's cancer is very unique. Could you go back, please, Michelle?
Sorry, I didn't mean to do that. There we go.
Yes. So in other words, these four different pathways that are mutated, and many different genes occur in each pathway. So one person may have one gene in the pathway mutated, where another person may have a different gene in the pathway mutated. And of course, each gene can have a variety of different mutations. Each mutation is going to radically change how that gene functions, or it's not going to do anything to the gene. There's going to be a whole set of different things that can happen here. So the thing to understand is that mutations in DNA cause cancer. There are specific genes. There's two classes of genes that we look at. They're called oncogenes and tumor suppressors. Tumor suppressors are genes that protect you. They're turned on 24/7, and they protect they repair mutations in your DNA. So if you get exposure to radiation or sun or some sort of carcinogen or chemical, and it causes a mutation in your DNA, then your tumor suppressor genes will fix that. However, if you have damage to your tumor suppressor genes, if they're mutated, then they can't fix it. And these mutations build up and accumulate in certain cells, and those cells become cancerous. So targeted therapies and most treatments, or most of the technology of cancer in the last 20 years has been on targeted therapies of some sort. So what a targeted therapy is it's a drug that will target a specific mutation. So if you have a mutation in your BRAF gene, if your V600, your valine at the 600th position of the gene is mutated, and it's, let's say, turned into a D amino acid, then there's a drug for that will target any cell in the body that has that particular mutation. So assuming that all of the cells that have the mutations are cancerous cells and your normal cells don't have the mutations, then these drugs will only target cancerous cells. So this is where technology is right now as far as cancer treatment. We're looking at targeting every single mutation we can.
Yeah, and the thing that's most important for you folks who are listening is what that means is more effective treatment, fewer side effects.
Yes, definitely.
More effective treatment, fewer like curative, or certainly making it something that is more of a low-grade chronic illness as opposed to a death sentence, which it used to be.
Yes. So in short, we focus a lot of attention and efforts on what we call tumor DNA testing. And that's where we isolate the DNA from the tumors and find out what mutations are causing your cancer. So there's many companies doing this. I believe, Michelle, you had a statistic of about 7,000 different genetic tests, tumor DNA sequencing tests. So this is different than the inherited genetic testing, which looks at damaged tumor suppressor genes that are in all of your genes. Those tests don't determine, they determine a susceptibility to cancer. They don't determine a mechanism that causes cancer, just an increased sensitivity to certain carcinogens. Whereas tumor DNA sequencing actually determines what is causing your cancer and how to target it.
Thank you for watching CTOM TV. Subscribe below and stay informed.